Switching over then to look at the distress tolerance module, I think it's fair to say that in the beginning of Jackie's treatment, we spent a significant amount of time discussing the skills in this module. The reason being that the DBT hierarchy recommends addressing life-threatening behaviors or issues at first. With addressing Jackie's SI as her first treatment plan goal, we found it beneficial to build a safety plan for her to use if her suicidal ideation or urges to engage in self-injury ever became unmanageable. Thankfully, she did not experience any SI to that intensity where we had to really start being concerned about her safety. But nonetheless, it was a good starting point to get her thinking about what activities and behaviors she could engage in for that distraction, as well as who she could access for support and what resources were available to her to help manage the SI. So that safety plan was really helpful to her in recognizing what she was already doing to help manage the self-injurious behaviors and suicidal ideation. And also recognize that activities like reading, watching TV, doing schoolwork, or doing some light stretching were really helpful distractors for her. It also helped her acknowledge who she could trust, like her boyfriend or a work confidant, to keep her mind off of the suicidal ideation and self-injurious behaviors when those urges emerged. Building a safety plan together also helped her and myself to build more awareness of the triggers to her SI. In particular, those triggers included negative self-judgments, being continuously judged by her mother, feeling overwhelmed with her responsibilities, and being in significant physical pain too. Now, when introducing the distress tolerance skills to Jackie, I used the metaphor of a thermometer to help her understand when to use certain skills, at least initially in her practice. When at higher levels of distress, she was coached to use more of the crisis survival skills like tips or distract with accepts, self-soothe, pros and cons, or improve the moment. When at lower levels of distress, she could practice using acceptance, willing thinking, or turning the mind to foster a different approach to her distress. This thermometer metaphor gave Jackie a framework to understand when certain skills might be more helpful for her. And from this module, Jackie found, I would say, the tip skill, the grounding skills, the deep breathing skills, and radical acceptance skills to be the most beneficial for her in managing distress and not making her situation worse. Now, this module was arguably the most important for her in working towards her second goal of engaging in self-care and stress management techniques too. Similar to her safety plan, we built a stress management skills plan to help her figure out what skills to use when she noticed her stress at certain levels. Now, if you remember back, I mentioned how she would sit down at her desk and check in with her stress levels. And when she was at a certain level, she knew exactly what skills she had to use when she was at an 8 or a 9, for instance. For example, when at an 8 or a 9, she knew that she had to take a walk outside in the cold air or hold an ice cube to the back of her neck to help her practice the tip skill of changing her body temperature to manage distress. When she was at a 3 or 4, though, she knew to practice deep breathing and grounding exercises while sitting at her desk or on her couch at home to help her manage any rumination or irritability or low energy. Now, I'll talk more about the grounding exercises that we used when speaking about her next goal, but the deep breathing exercises she found helpful for managing frustration and rumination. The two really that she found most helpful were square breathing and double exhalation breathing. With square breathing, I teach clients to breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, and then hold that for 4 seconds. Then repeat that process for a minute or two. When practicing double exhalation breathing, then, Jackie would breathe out for twice as long as she would breathe in. So if she was breathing in for 5 seconds, she would breathe out for 10 seconds. Or if she's breathing in for 3 seconds, she's breathing out for 6 seconds. This allowed her to calm her nervous system, redirect her attention out of her mind and into her body, and decrease stress in that moment. In addition to these skills that I've mentioned of deep breathing and grounding, having her examine the pros and cons of engaging in stress management behaviors was also really helpful to her in achieving her second goal as well. Using pros and cons allowed her to examine the benefits and ramifications of using other skills, or the benefits and ramifications of engaging in willful treatment interfering behaviors. To practice using the pros and cons skill, I would ask Jackie to set up a board that asked her to list out the pros, both of engaging in skill use and not engaging in skill use, as well as the cons of both too. Then we would examine how these pros and cons played out over the short and long period of time. I always leave it up to the client to decide what a short period of time is for them, as well as a long period of time. I remember for a pros and cons list that Jackie created when she was faced with the decision of doing her laundry one time after a long time of not having done it. She was able to list out the good things about both doing her laundry and not doing it, as well as the bad things about doing it and not doing it, both over a short period of time, which she deemed, I think, a couple of days to a week, and over a long period of time, which she, I think, decided was longer than a week. Now, needless to say, the possibility of the stench coming from her dirty laundry after a month of not doing it was enough motivation for her to jump into the task. Furthermore, she found it really helpful when we paired her use of pros and cons with her examining how her behavioral choices might harmonize with her values. When she would walk through creating a pros and cons list, she would ask herself which behavior aligned most with her values. For Jackie, being the quote unquote overachiever that she was, this was often enough to help her crush any type of willfulness that would pop up, as well as low motivation or any type of fear that would come up about engaging in a certain behavior. And it allowed her to jump into whatever behavior she was examining. We'll talk more about her values when we get to the interpersonal effectiveness module, though.